It's Friday afternoon, talking about hips and knees. Hey guys, oh, hey Natalia. Oh boy, this is gonna be a good one. Lots of info today. Hips and knees. I'm gonna give a couple minutes for people to join. I know we're a little earlier in the day here. People are still working. Help my knees, you got it. I'll help your knees as much as I can from here. Hey guys, hi Kate, MC Weinberg. Gonna wait a couple more people to show up. Usually give it about 2 minutes, then we get rolling. Yeah, so hope all your weeks went well, or as good as they can under these circumstances. My wife and I have been cooking up a storm. Hey Jane. Hopefully the camera angle is better for you this time around, Jane. Yeah, so we're talking hips and knees today, but we cannot address both of those things without, hey Kate, we can't address both of those things without talking about the ankle and the toes. So we have a lot to cover. We have, as much time as this goes, but I want to keep it nice and compact. I want to respect your time. I want to get home to my wife. I want to have a drink. It's Friday afternoon. Yeah, so like I said, toes, ankles, hey Steven, toes, ankles, knees, and hips, it's all getting covered today despite it saying hips and knees. A lot of times when the knee hurts, at least in my 10 years as a PT, it's two areas, unless it's been a traumatic accident. The two areas being the front of the knee and the side of the knee. And we talk about patellar tendon and IT band stuff. And so those are the two, what's up Troy? Those are the two areas that we'll probably be addressing mostly today. And when we talk about the patella, the front of the knee, that patellar tendon, quad tendon, we're going to have to look a little bit more at the toes and the ankle, and then when we look at the side of the knee, the IT band stuff, we're going to be talking about the hip. Going to be chatting a little bit here at the beginning because I think that this info is important when it comes to your hips and knees. Oftentimes, we're on quarantine. A lot of people are running a little bit more, doing more body weight squats and things like that. So we've been increasing the amount of load that we put in our body. And now when I worked at a PT clinic back closer to my college years, I was on a college campus, and we would see increases in spikes in knee pain at 2 times a year. One would be right after the holiday break, so everybody's trying to lose all the holiday weight, so they're running more, therefore putting more stress in their knee. Hey babe. And then the other time would be right before spring break, because everybody wants to look good in their bathing suits. And so we would see this increase in volume of running, and all of a sudden people's knees was hurt. And so what would happen is we're putting too much load or too much volume into our tissues, and they just can't handle the amount of force that we're putting into them. And therefore, they get irritated or they start breaking down and they can't rebuild fast enough. And therefore, there can be some pain and some dysfunction. And so now that we're all home and we have some time to work out, people are running farther, or they're doing a little bit more resistance training. Maybe it's just a little bit too much for what their bodies or what your bodies are prepared for. And so we want to maybe back off a little bit at first. That's usually the number one thing that I'll suggest. Then ice and heat and other modalities that can help, help your pain decrease. But then we have to build your body back up and look at your running form, look at your shoe wear, look at the surfaces you're running on, look at how far, how often, are you just sprinting, are you going long distance, all that stuff. So it's a complex issue, but we're just going to be going over some stretches, some mobility, and some strengthening exercises today that can help your foot, ankle, knee, and hip. So the first thing we're going to start with is a test, and the last thing we're going to do is a test. And the first test that we're going to do is a heel raise test. And now if your balance is a little off, you're going to want something to hold on to. It's not going to affect your test. I have a stick back there that I'll probably use just because. And I want to see, is there a discrepancy between how many heel raises you can do on the left and how many you can do on the right? We shouldn't see anything greater than a 10% difference. So if you can do 10 on one side, you should be able to do 9 on the other and no difference. And that, I'll let you do the math. And I would suggest stopping at 50. I'm not even going to finish it. So I'm going to show you the test. I'm going to suggest it. But we want to have even ability to propel ourselves forward when we run or when we're doing any activity in general. And if we don't, maybe that can be contributing to your baking the bread and stretch, great. That can be contributing to the amount of force that we put in our knees, or maybe our gait pattern is changing because we can't withstand the amount of load that we have to push forward. So I'm gonna move back here. Oh, microphone down. Okay. So, oh, you're welcome. Was it Amy? Amy in NYC. Thank you. All right, so I've got my stick to help me balance. I'm gonna take one foot off the ground, and I'm just going up and down. And like I said before, if you feel like maybe I rushed this and you're not going to be able to get through it all, go back and do it on your own and just see what that difference is. And you're looking to see, is there a difference on either side of 10%? And I'm going to stop you at 50 on this one side. I'm not even going to get there. Like I said, I'll probably go through about 20. I think I'm probably halfway there. So now I know that now I don't have a discrepancy, but I ran a half marathon back in the fall and I did one of these tests after and I said, oh my God, no wonder my Achilles was really, really hurting on my right. I could do, 100, maybe 80 on my left, and on my right, I could only do about 40. And so I spent time building up my calves, and then I started feeling better as I built that strength up, as I built the tendons and those muscular tendinous junctions in my leg up. I started to feel better. And that's all it took. I was still running, just not as much. And so who knows, maybe you got 50, maybe you only got 10 and 6, That shows you that there's a discrepancy there. Great. And there was a lot of research just put out, I think it was earlier in the fall or over the winter, that showed people that the soleus muscle is actually one of the main propelling muscles of when we run. It shouldn't be our quads. It should be our butt muscles and our soleus, which is one of our calf muscles. Hey guys, whoever just joined, we're going over hip and knee with a huge focus on the foot and ankle today because they are so important for the mechanics there. All right, so I'm going to stop it there. But if you weren't able to finish, go back on your own after all of this stuff and see, is there a discrepancy of 10% or more? So we used our calves, and if you've been following along with any of my content over the past 2 weeks, you know that if we use something, I'm probably going to want to stretch it after. So yes, that was a test to start, but now we're going to do a nice calf stretch. So maybe you need a wall, a couch, a chair, something to push against, and then you're going to drop one foot back. You're going to just straighten your knee, so we're not doing the bent knee yet, and you're just going to stretch out your calf. We're going to be here for 1 minute, and unfortunately for you, I forgot my watch today, so I'm going to do my best to figure that out. Now, we're not treating any specific conditions. Knee pain and hip pain are pretty general, or they can be. So if any of this stuff bothers you while we do it today, just take a break, find a nice stretch that you know agrees with your body, and we'll pick something up probably in a minute or two. You won't miss much. But maybe you don't feel a stretch here, by the way, and you do feel a stretch when you bend your knee. And you're trying to keep your heel down, and maybe that stretch goes from a little bit, maybe you're getting a little behind your knee, but when you bend your knee, you get a big stretch back here. That's more of your soleus muscle, that one that I was saying propels us forward. So if you've been running a lot more, that muscle's probably going to bark at you, especially if your knees, ankles, or hips are, giving you some problems lately. We're going to switch sides. I'm just going to do the calf stretch. I get a nice little calf stretch here. I don't feel a need to stretch my soleus here, but once again, if you don't feel that stretch, bend your knee, get more of a soleus stretch. Try to keep your heel down while you do it. Maybe you feel a pinch in the front of your ankle, and that can lead to a bunch of issues. And we're going to go over why the toes and the ankle are so important to your knee here in just a second. But you can see I have good dorsiflexion in my ankle, and therefore I can get good hip extension. Now if I don't have that range of motion, and maybe I don't have that range of motion in my toe, I'm not going to be able to get into this hip extension if I'm running forward. And so I'm going to have to shorten up my stride, and I'm going to put a lot more force through the front of my knee when I run. And so if I can't get into that toe extension or even the dorsiflexion of pulling my toes up, if I can't get into that, what happens is the force from the ground as I'm trying to propel myself actually ends up being in front of my knee like this. And when I do that, my quad is what's going to have to push me forward. It's going to have to overcome some inertia to want to actually push me back, and that's what's going to cause me to go forward. And that's going to put a lot of stress to your patellar tendon. And so we want to make sure we have this good range of motion to get into some extension, and then that ground reaction force stays behind our knee and causes our soleus and our glute to propel us forward. That's what they're built for. And so it's important that we look at these range of motions in our toe and in our ankle for our knee pain. So we stretch our calves. You can put your whatever you're using to balance away. And we're going to go into something called quadruped rocking or quad rocking. And you're going to have to get down on the ground. You're going to tuck your toes underneath like so. Now, if you can't get them under like mine, just try your best. You're going to go on your hands and knees, and you're going to keep a flat back. And from here, you're going to push back, make some space in your knees to get your hips between them, and you're going to push back. And you're just loading up your toes just a little bit, and you're going to rock back and forth. And you want to go just to the point where you feel your back start to move. You don't want to dump here into your spine because we don't want to be creating lots of spinal flexion with this. If you had a water bottle or a foam roller on your back, it would just stay right in place. And we're going to go just for 5 more, loading up the bottom of the feet, getting extension in our toes. If your knees are bothering you, make sure you're on a mat while you do this. It's not excessive motion, we're just introducing more extension into our joint, stretching out that big toe. All right. So we're going to keep the same position with our feet. We're going to continue down this path of mobilizing and stretching out the feet. And we're just going to sit back onto our heels. And if this is bothersome, you can always go up here into tall kneeling. You're not going to load your toes as much. Or if this still bothers you, you can go back down here into quadruped. But for now, we're just going to be here about a minute. And we'll just stretch the bottoms of those feet, and you can kind of shift your hips. You can shift your hips side to side, maybe load one side up more than the other. And if this bothers your knee, go into that tall kneeling position, or even to that, quadruped position we talked about a minute ago. And so we stretch, we mobilize, and then we use these new ranges of motion that we've gained. We see what kind of difference, how do we feel as we start moving our body through new ranges of motion, saying, hey, brain, central nervous system, remember this range of motion we used to have? Yeah, let's not forget it. And so we've been here about a minute, rocking back and forth. Maybe you're still doing your quadruped rocking. But now we're going to be laying down on our back, and we're going to start to incorporate a little bit more of our hips to the mix. We talked about the foot and the ankle being a primary driver of what occurs in the front of the knee. And the hip is more about controlling your femur or your thigh bone. And if you don't have great control over that, what happens is the femur starts moving underneath the kneecap. And when you get that, you can get some of that lateral knee pain, or if your knee dives in when you run, maybe you notice when you land, your knee goes in, you're going to put stress through your IT band. A lot of people will say, oh, my IT band needs to be rolled or stretched. Well, I'm going to tell you right now, your IT band cannot be stretched. No matter how much you foam roll it, no matter how much you stretch it, no matter how much manual therapy you put into it, you're not stretching it. In fact, people have looked at this. They've cut IT bands out of cadavers. They've put them on, crudely, a board. They hang it with a 2,000-pound weight hanging off of it, and it doesn't stretch more than 2 millimeters after 24 hours of hanging there. So unless you have the world's strongest hands, or you're foam rolling with a pneumatic press, you are not stretching your IT band. What you are doing is you're giving input to your body, and it can then maybe produce a different output, because pain is an output from our brain to a certain part of our body. And so the foam rolling kind of just gives you a different glide or slide of that tissue on your quad. Maybe you are actually foam rolling your quad instead, and that feels good, and that can be stretched, and that can relax, and that can take some pressure off the knee. But it's not stretching your IT band. There's no such thing as muscle adhesions unless you've had surgery, and you're not stretching out that tissue. But what you can be doing is you can be stretching your quad, you can be producing a novel stimulus of maybe some lateral movement, because the IT band is used to this vertical move, but if we can kind of put input side to side on that or horizontally, maybe the brain says, oh, I don't know what this is. Oh, I kind of like that. And it just reduces your pain. And that's why foam rolling can feel so good to your IT bit, or not feel good, but can be effective. Where was it? Oh, so we're going to start working on the hip. We're going to be doing a little bit of stuff for control of your ankle, control of your hip, stretching out your hamstrings and your calves. And to do all that, you're going to be laying down on your back. And this one tends to show up a lot with my stuff. So you're going to be on your back, and you're going to hug behind your knee, and you're going to pull your toes back towards your head. You've stretched your calves, you've stretched your toes, so this should be a little bit better than if you had done it about 20 minutes ago. And you're going to go up and down 15 times. And I have a little shake in my quads. I was practicing this stuff earlier. Quads are a little tired. That's all good. And keeping that dorsiflexion, those toes pulled back towards my head so I can get as much of a calf stretch as possible. I'm also going to get a hamstring stretch, because your hamstrings actually cross behind your knee and they insert underneath your calves. And so anytime you're getting a calf stretch, you're probably also getting a hamstring stretch too of some sort. And I think I got 4 more left. And after these 2, I'm going to keep my foot up in the air, and we're going to make some ankle circles. We're going to use that range of motion. All right, so I'm up here. Now I'm going to make 5 circles with just my foot, using as much range of motion as possible. Clockwise, counterclockwise, doesn't matter, because then we're going to switch. And so we're using our plantar flexors, our dorsiflexors, our inverters, our everters, all the muscles of the lower leg that we ignore and we just pound away on as we run or as we bike or do yoga or all these challenges. Great. Now, before we move on to the left leg or the other leg, we're going to do some hip circles. So we made controlled movements with our up leg. I'm going to have you bend your opposite knee. You're going to straighten off the top leg and take your hands away. And you're going to come out to the side, swoop down to the bottom position, and then come up 5 times. And you want to be braced through your trunk, be really stable, so your hips don't move, except where you're moving your leg. Okay, so you don't want to rock your hips side to side. We're going to make 5 in each direction. And the number one question I guarantee that I'm going to get on that screen is it okay, or what does it mean if my hip is popping? And it probably just means your hip flexors are tight and they're going over some bony prominences in your pelvis. And that is completely fine unless it really, really hurts. So now we've switched directions, obviously, and I'm just going to make 3 more. Stretching out our adductors, our hamstrings, our calves. And 1 more big one, and then we're switching sides. Okay. Get a little bit of a core workout with that one too. We're incorporating all parts of the body. Now we're going back to the calf and hamstring stretch 15 times. And so like I said earlier, if you know me, we're going to do some mobility stuff. We're going to stretch, and then we're going to use it all. And that use it all portion is coming up here. But we're going to do a hip flexor stretch next, because as we make these hip circles, you're going to use a lot of your TFL, a lot of your hip flexor, and that's the best time to stretch. Because right after you tell it when to turn on and off, go ahead and stretch it. I have no idea what number I'm on, so I'll call that 10. Whew. It's Friday, everybody. Another week down. It's a good thing that you're joining, taking care of your body. All right. So, sorry, still holding. Ankle circles, 5 in one direction. And then 5 in the other direction, using all the muscles of the lower leg. If you feel a little numb, tingly, burning sensation, maybe you're stretching out your sciatic nerve. Maybe you got something, some tightness in your sciatic nerve tract, which goes down the back of your leg. Good. Okay, so now it's circle time. So I'm gonna bend my opposite knee, I'm gonna swoop down, come back to the bottom, and come up. And there's 1. And we're making 5, 2. Once again, popping is okay as long as it doesn't hurt. 3. Stable through your trunk, bracing your core. 4 and 5. Now we're going the other direction. And it's okay if you have a bend in your knee. You don't want it to be excessive here, but try to straighten your knee out. But it's okay if it's a little bent. Mine's bent. That's cool. And 4. And last one. 5. All right. So you're just using our hip flexors a lot. So you're going to grab a pillow if you have it. You're going to put it under your knee. You're here because your hips and your knees might be bothering you. So you're probably going to want a nice little soft cushion. Mine's over in the corner. I'm going to leave it there. I got a little mat here. You're going to start bent over, tucking your toes underneath in the back. We've gained some range of motion in our toes and in our ankles. Let's use it again. Let's find all these opportunities to use this new range of motion. And so toes are tucked. It's going to help me balance. I'm going to tuck my pelvis underneath, and then I'm coming up. And I feel a nice big stretch in the front of my hip. My psoas, my iliacus, my TFL, my quads, all these things that flex the hip, we call them your hip flexors. All those things are opening up. So I can get into my glute and produce power more. Regardless of the sport I'm playing, I'm probably going to need to produce power. And it's got to come from your hip. Shouldn't come from your back. Shouldn't be coming too much from your quads, although those will help a lot too. We want to really open up our hips so we can get into some extension. And once again, if this is too easy, go forward, grab your ankle, and come up. You're going to lose the ability to work on your toe and ankle range of motion there, but that's okay. If you need the hip flexion or the quad stretch more, go get it. All right, so we'll call that a minute. Like I said, don't have my watch. Can't count to 60 very good. I can't count to 6 very good either if you follow along. Toes are tucked in back. Pelvis is tucked at the hips. Up nice and tall. Just getting that nice quad stretch. Protecting your back. We're seeing how, everything is related. Opening up your hips will help your back. It's going to help your running mechanics. It's going to help your ability to just walk around comfortably. Opening up your toes and your ankles are going to actually help your knee feel better, so maybe you can produce better hip extension. It all feeds into into each other. The body doesn't work in these, single segments. We have this concept called regional interdependence, where things matter on their own, like you want to make sure you have good toe extension, but that matters for your hip too, and vice versa. All right. Okay, so we're going to be dropping back down onto your mat, and I'm going to show this one from kind of a down the line view. It's called hip abduction, but we're not making pure abduction. We're not going to make pure extension here, but you're going to be laying down on your side. The setup position is going to look like this, where you have your bottom knee and hip bent, your top leg is straight. Now I'm going to be kicking back towards that wall, but I'm going to show you from the side here. So I'm down here, I'm on my side, and I'm lifting up and back, and I'm squeezing my butt cheek. And I'm going to put my hand here, so I know if I do it right, if I feel a dimple form in the side of my butt. And you'll see that my hips and trunk are staying up towards the ceiling. I'm not kicking back and rolling my hips open like this. I've got my trunk is braced and stable, my hips are vertical, and I'm kicking up and back. And I'm feeling this right on the side of my butt. And this is where we start to address your IT band. That lateral knee, maybe lateral hip pain that you're starting to get. And we're going to make 3 more. I think that's about 12. Good. Strong, healthy hips start with strong, healthy butts, okay? All right. And so we're lifting up 12 times. And then this is going to be the easiest glute exercise we have today. We're going to be doing some single leg deadlifts, some Cossack squats, which we'll go over in a second. But then we're going to do some squat walking, which is going to really force our big toes into extension. 3 more, I guess. Feeling that dimple form on the side of my butt. And my right hip is weaker than my left, so I'm feeling that one. All right, so this next exercise can be a little bit bothersome to the big toes if you don't have that range of motion, maybe even to the ankles if you're a little bit stuck there too. If you have, if you're here because your knees are really bothering you, just be mindful of this exercise. It's called a squat walk, and sorry, I think the nail's showing up for the first time. And so it's called a squat walk, and it's gonna really close your knee joints up. And so if you are feeling like your patella or your kneecap is bothering you a little bit, maybe you just go back down to that quadruped rocking, that hands and knees position, just rocking back and forth while the rest of us are doing these squat walks. And I'm gonna show you a couple from the side, then I'm gonna do a couple head on, and you're gonna do them at home, and you're just gonna kind of go back and forth for 10 total repetitions or 5 walks on each side. And so down here, I'm in a squat, my heels are up, and I'm actually gonna go, let's see here, I'm gonna go up onto my toes a little bit. Now this in itself might be really, really stressful to your feet, and that's okay, we're working on all those foot intrinsic muscles. And maybe if this is maybe a little bothersome, but you don't wanna do your quadruped rocking, you can walk right now up on your toes and try to force those feet to get a little bit stronger. But for now, the rest of us are gonna be down here, and we're in this up on our toes position, and you're gonna rock your weight towards one leg, and you're gonna step forward with the other. And then you're gonna rock your weight to that foot, and step forward with the other. And you'll see my toes are going into tons of extension, and I have to go through dorsiflexion. And so I'm going back and forth, I'm shifting that weight, I'm taking my time. And I don't have a big runway here, filming vertically. Forcing those toes to go through extension, using that range of motion that we gained. We only have a couple left here, and then we're gonna move on to Cossack squats. Maybe you're walking up on your toes, strengthening those feet, or doing your quad rocking if you need it. And one more time, back and forth for me. It's all through the chest. Okay, all right. So, we were using our toes and our feet. They had to go crazy there to support us, to create balance, to make weight shifts. All these things that we do as we're, running, walking, jumping, landing, squatting, deadlifting, single leg deadlifting, which we will do here in a second too. So it all kind of works back into itself. So we're gonna do some Cossack squats. Cossack squat is kind of like that weird squat that the Russian guys are doing while they're dancing. And you're gonna stand up, give everybody a second to get there, and maybe grab a sip of water. And you're gonna start with your feet wider than your shoulders. And now you're gonna imagine that you have a chair behind your right heel and one behind your left heel. Maybe you do have a chair there, I don't know. And what you're gonna do is you're gonna go from trying to sit in one chair, back up to the middle, to trying to sit in the other chair. And why are we doing this? We're doing this to load up our lateral hips and stretch our medial or inside thighs. Because a lot of the stuff that we do, we're running, we're doing it in the sagittal plane. We go forward a lot, we squat, it's a sagittal plane movement, we do kettlebell swings, that kind of thing. It's all in the sagittal plane, this plane right here. And I don't want to say this front plane, because the frontal plane splits your body here to here. And we don't do a lot of stuff in that frontal plane, these side-to-side movements that are so important to maintain lateral trunk stability, butt strength, and ankle stability. So we're going to go back to this wide position. Feet are forward or slightly turned out. We're not going into, I forget what it is, fifth position, first position, something like that from ballet. We're going out wide, toes forward if you can. We have one chair behind each heel. And I'm going to go and I'm going to try to sit back, and I'm keeping my chest up. I'll see if I can show you from this angle a little bit better. So I'm sitting back, chest is up, touching down, coming back up to the middle, and then sitting in the other chair. And we're gonna make 5 more to each side. We're loading up those lateral structures in our hip. We're challenging the lateral structures in our lower leg. All things that we need to have nice and strong so our knees can take less load as we do activities. And for that matter, our hips can absorb, or the muscles of our hips can absorb the shock in the joint, that ball and socket doesn't absorb the shock. So we have somewhere between 8 and 12 times our body weight going into our knees and going into our hips as we run or jump. It's a lot of weight every step, which is like somewhere between 1,200 and 1,800 steps, depending on the person, for every mile. It's a lot of load. All right, and we're just gonna do one more to the other side. Good, okay, and now that one is great to actually load up. A lot of people can do a lot of weight there, kettlebells and dumbbells. There's ways to do it with rubber bands, but you're gonna feel like the outsides of your hips are doing a lot of the work. The insides are getting a big stretch. And so we're gonna move on to the last strengthening exercise. This one, I've thrown it in with hips, I've thrown it in with back. Now we're gonna do knee and hips. It's a single leg deadlift. Why? Well, we've got all this mobility and range of motion in our feet now. And so our body might not be familiar with that range, and so our balance might be a little bit off. So we want to give some input that says, hey, you have to learn how to stabilize yourself now that you've gained some range of motion. And so that's why you're doing it for your foot and ankle. You're going to do it to eccentrically load your patellar tendon. So as you have that foot in the air, the stance leg, and you're going down is eccentrically loading. It's going to maybe cause a little bit of tissue adaptation over time that leads us to stop hurting. And then you're working on your glute. We're working on all planes of movement. There's 3 planes: frontal, sagittal, and coronal, horizontal. And we're covering all of those at the hip. And so we're really, really doing a lot with this exercise. We're going to do 8 on each side. You want to make sure that you have your back leg straight and your back straight. And you're going to go down and touch with your opposite hand, or not touch, but go down towards the ground, and then you're back up. I'll show you from this side here. So there's 1. We're going to be making 8. 2. My wife said my butt looked good while I did these last week. 3. That's really why I have them in here. Oh, and see, even my balance is a little off today. Stop looking at the camera. 5. Got 3 more. 2. And maybe you got a little bit more wobble in your hips and knees. 3. Nice. Okay. Moving on to the other side, doing the same thing. And then, like I promised, we have one last test to do. We started with that heel raise test that maybe you're going to revisit a little bit later. Hope you all are doing well out there at home. Staying quarantined, staying safe, staying healthy. Got 3 more. And 3. Okay, so we made it through our mobility, our flexibility, and our strengthening of our feet, of our toes, of our knees, and of our hips. Now this last little test is just to point things out to you. In this test, what it is kind of introduced to the world from another physical therapist. His name is Kelly Starrett. He started Mobility WOD, which has turned now into the Ready State. He is a very, very, very smart guy. I posted a video earlier from Brian McKenzie, who is a buddy of his. 2 really smart guys putting out great content. This test is part of what we call the 10-minute squat test. Can you hold the bottom of a squat for 10 minutes? Can you get low? Can you squeeze your knees down? Can you keep your heels down and your chest up for 10 minutes? Now, I don't suggest people just jump in and try to get 10 minutes. I suggest people start with whatever they can do. Maybe you can get 30 seconds. Maybe you can get a minute. Maybe you can get those 10 minutes, great. But you start with what you can do, and then you gradually build. If you can only get 30 seconds, maybe you can get 20 seconds 5 times throughout your day. Therefore, you've started to build up your capacity. You're stretching your patellar tendons. You're working on your thoracic mobility. You're forcing your ankles to go into dorsiflexion. All things that we need for good, efficient movement and action. And so I'm just kind of exploring the different ranges. Can I keep my chest up a little bit more? How do my feet feel? Do I feel like I'm really stressed? Are the fronts of my shins going crazy from trying to create that dorsiflexion so I don't fall over onto my butt? Or is everything kind of relaxed and I feel good? And as you do these stretches and you work on your mobility, you might start to find that this little test becomes easier and easier. Maybe you haven't done a ton of squatting like this squat test, but you've worked on things that make getting into this position a little bit easier. And so, like I said, I don't suggest going for the straight 10 minutes right off the bat. Things aren't going to absolutely be fried if you do that. Just take your time, do what you can, get out of it when you want to get out of it. But can you improve it? Can you work on your quad flexibility so your knees aren't screaming at you right now? Can you work on your calf flexibility so you can get into dorsiflexion and keep a more upright posture, where the more upright you are, the less work this is. If I'm really forced here and I'm down here, that's a lot of work for me to do, and I'm gonna get tired really, really, really quick. And so you're just hanging out down here. Maybe you've taken your break already and you're just listening, and that's cool. If so, just pop that knee down, get those toes underneath you, tuck your pelvis, and maybe go up into that hip flexor stretch on each side. But for the rest of you, if you're holding it, great. If not, so be it. So we talked a lot about a lot today. And if you have any questions, please don't hesitate to reach out. You know where my direct messages are. My email is kineticpotentialpt@gmail.com. You can find me at that web address, kineticpotentialpt.com. Pretty easy to find. If you have any questions, if you need to set up a telehealth visit, if you just say, hey, this bothered me, what else can I do? I'll never hesitate to reach out and help, or to help you if you reach out. So please do. Thanks for joining. I'm gonna scroll through these questions now. And don't forget to go back and do that little heel raise test and see, is anything kind of deficient there? Oh, there's Patty. Hey guys, well, a lot of people joined today. All right, yeah, okay, so not too many questions today. Like I said, we went over a lot about a lot. So you know where to find me, Kinetic Potential PT. And all of you have a wonderful weekend. Reach out to your loved ones, say hello, reach out to your friends. Yeah, so like I said, if I can help you, reach out. Until Monday, where we'll be going over low back pain, take it easy, and yeah, take care. Okay, it's a really good one for you runners. That's right, keep running. So, all right, guys, I'm gonna sign off, and I will talk to you later. See you Monday for low back pain. Wednesday is gonna be shoulders and necks again, and next week is gonna be hips and knees again. So we'll see you. That's on Friday. So I'll see you then. Have a wonderful weekend, and enjoy your friends and family.